Welcome to Cafdil Healthcare here on Cafdil Television. It's imperative that every week we come your way with another topics that will help you to know how important it is for you to always visit hospital for screening or for checkups and so forth. Today is another day that we're going to present to you one of the most important diseases that we're supposed to, especially women, supposed to take a very good care of it. You have to always visit hospital and so forth. Today we are presenting to you a virus that causes cervical cancer, and we promise to give you very exciting and very educative show today. So I encourage you to sit back and listen to professionals' advice and practical tips that will help you thrive. Today I have my guests seated already, but before that, let me also remind you that we are live, or we are on Facebook and on YouTube. Facebook is Cafdil Cape Coast and YouTube is Cafdil Edu. Edu is spelled E-D-U. So that is no mistake on that. So my guests are seated already. I have Professor Dorcas Obri Yeboah. She is a professor and a medical doctor at the Department of Microbiology and Immunology, School of Medical Sciences, University of Cape Coast and Cape Coast Teaching Hospital. She is also an ambassador for International Papillomavirus Society Ghana chapter. Once she is a professor, ambassador always goes with Your Excellency. So I will say, Your Excellency, you are welcome.
Thank you very much.
All right. I also have Esther Lamte Mills. She is a midwife at the Cape Coast Teaching Hospital and also a member of the International Papillomavirus Society Ghana chapter. Esther, you are welcome.
Thank you.
So I would always encourage you to, when you go on Facebook, just follow us, share for your people to also get access to this educative show. My name is Kojo Arthur. Prof, I will start with you.
Okay.
Since this is IPVS, which has to do with international, so I will let you give me or tell us the overview of this IPVS. How many countries are involved, Ghana chapter, since when, and the theme for this year's IPVS awareness.
Okay. Thank you very much. So the International Papillomavirus Society is a global society of about 120 countries currently. It has existed for a long while. In fact, I have been a member since around 2013 thereabout. So it's a society of people of various health backgrounds who are focusing on the issue of HPV and the conditions it causes, particularly cervical cancer, that we want to work with the international agencies like the World Health Organization to eliminate this very preventable cancer from our life. So Ghana chapter came into being when last year the International Society decided that to make sure that countries can have focused interventions within their settings, they would select ambassadors for each country who can then coordinate the activities within country. So in Ghana, 3 of us were nominated as the ambassadors and selected by the society. So myself, and then Dr. Dasa, who is in Kumasi, and Dr. Donko, who is in Sunyani. And with the 3 of us, we came together and organized health professionals, doctors, nurses, advocates, lab scientists, and came together. And then the Ghana chapter was launched in July 2023.
Ghana chapter.
Yes.
Of which you are, the 3 of you are the ambassador. Oh,
Exactly.
okay. And so you have, how many members? The members are many, eh?
Now we have over almost 250 health professionals in Ghana together with us working on this.
Oh, okay. Of which Esther is part,
Yes.
a member. Okay, so what is the theme for this year's awareness campaign?
Okay. So every year, IPVS comes with a theme for the awareness creation. This year, as you can see on this, it says one less worry. One less worry. So basically, the message is that there are so many things happening in this world that gives us problems. But there is one worry that we know we can take off our list. That worry has to do with cervical cancer and HPV. We can't take that off our worry. So we want to create awareness, help people see how together with specific efforts we can get rid of this one worry in our life.
Upon all our economic hardships and all
exactly.
Stuff.
Let's take this one off.
We cannot take it off. With this one there, we can take it off. Well, that is, if you visit hospital regular for screening, you can take it off easily. And so forth. But Esther, let me also come to you. You are a member, right? Yes. So as a member, what's your duty? What do you do to help this?
Okay, so being part of the IPVS, especially Ghana chapter, they organize webinars whereby we are told what to, in fact, information we should give out there, because mostly when you don't have the good information to even give to the public, when you go out and you're educating, if care is not taken, you don't give them the right information, then based on that there'll be a lot of misconception. And so IPVS gives us the opportunity to learn more about HPV and its condition, especially cervical cancer. And as members, we are empowered that wherever we find ourselves in our little corners, we educate our family members, church members, friends, and the facilities we work in, most of us are health professionals, and so when we go to our various hospitals, we serve as advocates when it comes to cervical cancer and HPV-related conditions, ambassadors. All
right. So we've been mentioning human papillomavirus, and so what is it? What is the human papillomavirus?
Okay, so human papillomavirus is a type of virus which is acquired through sexual means. So it's been classified to be part of the sexually transmitted diseases or infections. And mostly it's transferred from one person to the other. And mostly every woman or every man, if you start having sex at a point in time, you come into contact with the virus. But our immunity fights the virus and then we are free from any diseases. But then if the virus becomes persistent on any part of the body where the virus finds itself, it becomes a concern to especially we IPVS members, because it means that if you don't screen to know your status, you are likely or have a higher chance of acquiring cancer, especially our women, cervical cancer in the latter parts of their lives. Which we are is part of the reason we are here. We don't want our women to have cancer.
So from the way you are saying things, it means that if you're a woman or a man and you have had sex, certainly you may have. So let's take this 10 people, 10 ladies who have had sex. How many do you think are likely to be infected with the disease?
So most likely between 8 to 9 are at chance of
high risk.
Yes. Having the virus and not cervical cancer.
Yes.
They are two different things, yes, actually. So coming into contact with the virus is different from having cancer. Right. Exactly.
Okay. So how a person, how does a person get infected with this HPV?
So like I mentioned, it's transmitted from one person to the other, and mostly is through sexual intercourse. And so if you have unprotected sex with someone who is exposed to the virus, you have a higher chance of coming into contact with the virus. And I must say, I said unprotected sex, so you can have sex using condom, but it wouldn't protect you fully from acquiring the virus. So if you use condom, it doesn't mean you are free from acquiring the virus.
Prof, let's talk some more about the disease caused by the HPV. Is it only limited to cervical cancer in women?
Okay, thank you very much. So I think Esther mentioned and kept repeating that most commonly cervical cancer. Yes. but that should tell you that there are other conditions that it causes. So the men should not begin to think that these are women issues. So sit down and listen, because as a man, you are part of it. Because for everyone with HPV infection, the other conditions is known to cause is oral cancers, it causes anal cancers, it causes penile cancers. These are all related to the type of sexual activity a person may be involved in. So this virus is able to cause these other cancers also for men. And the reason we highlight cervical cancer is because it's the commonest and most frequent cancer that has been associated with HPV. But all the other types, penile cancer, anal cancer, oral cancer are part. And even conditions like genital warts, where the person gets some growth around the genital area. That one is not cancer, but some types of HPV that do not even cause you cancer will cause you this growth around the genital area, which we call genital warts.
So if you have the virus, does it show symptoms?
So this is the tricky part of this virus. So having HPV infection itself has no signs and symptoms. So there's nothing you can see on somebody and just assume that they may have HPV infection. And there's nothing you can wait to see in your body that will tell you have HPV infections. Unlike other diseases that you say, oh, if I have headache and fever and this, then I know I may have malaria. When it comes to this virus, it just sits and hides wherever it is, in whether on your cervix or the inner region, the throat. It just sits there and progressively over time start causing changes. So by the time you have any sign and symptom, then it means that you truly have advanced disease from it. So if a person waits to see signs and symptoms to know that they have HPV infection, then it means that person is coming up for screening or to healthcare setting when they already have cervical cancer or anal cancer. So HPV infection itself does not have any specific associated symptom at all.
Then it's a serious something that we have to also take a second, especially I was going to say especially ladies, but I think they are
still especially more. Women, because cervical cancer is far more common than the other types.
So if there are no early symptoms of HPV, Esther, like Prof said, then how does a person know if he or she has this HPV infection and the particular type? How does the person know?
So basically it's through screening or testing. And so until you visit a facility, a health facility near you to be screened, you wouldn't know whether you have the virus or not. And like you mentioned, we have various types. And when Prof was explaining, she made mention of having genital warts, which also is caused by HPV, but we have types. And then we have the one that we are most worried about as women, which is the cervical cancer. And so until you get screened, you wouldn't actually know whether you have the virus or not, because it doesn't show any signs and symptoms.
That is my worry. That's something that do not show any signs and symptoms, and you would have it, harbor it for so long a time. When it happens, then you are going. If you just tune in, then you watching Cafdil Health Care. Yes, Cafdil Health Care on Cafdil Television. But don't forget to follow us also on Facebook and on YouTube. But one thing that I also want to bring to your attention is that, you know, this program involves a lot. And so we plead with you to also support us in any way. Our Momo line is on the screen. You can support us. But if you're a businessman and you want to go further, you want your business to be mentioned on this show, you can call the same line and speak to our authorities for you to know what actually to do. So we can always come on your way with a very important topics that will always help you to realize that there are diseases there that you need to always take good care of yourself. Now, Prof, if a woman has developed significant advanced cervical lesion or cancer, what are some of the things that she will experience?
Thank you very much. So first, let me repeat. We do not want to find women with cervical cancer. Cervical cancer is an eliminatable disease, a disease we can eliminate. It's very preventable, so we don't want it. Of course, there are many who have never screened. So if you have changes on your cervix, that is the mouth of the womb, then the signs and symptoms that now begin to show are that, for example, a woman who is menopausal, no longer having the menses, may suddenly see that he is beginning to bleed again from time to time. A woman who is even still having the menses may notice that in between, when the menses has passed, in between he still have some bleeding. The person may begin to have lower abdominal pain. The person may begin to have some vaginal discharge, which would then be offensive, increase in quantity, change in color. And such a woman, as the disease advances, when they have sex, they may have significant pain, and in fact, every sex, they may find that they bleed after. Waist pains and other things, you start losing weight. So depending on the stage at which the cervical cancer or changes has reached, the signs and symptoms will be different, but it will just be progressively getting worse. But nobody, no woman should wait till they have these symptoms that I mentioned before they are screened at all.
But you made mention of menopause. Even though we are not doing menopause, but you made mention of, just want to know how many years, at what age do women get to your menopause?
It varies. We know that usually women will say pre-menopause may start for you late in the 40s, early 50s, and then from 55, quite a number of women would have reached menopause. But again, there's no one age for every woman. Depending on the age the person started having their menses and other factors, the age may vary within the 50s thereabout.
Okay, so Esther, if you are found to have this HPV virus, can it be treated?
Yes, it can be treated. So if you have, we do the HPV screening, and then we find out that you have the virus, and the virus has caused changes on the cervix, what we normally call the precancerous lesions. In fact, this cervical cancer or this type of cancer gives us a very long time, in fact, enough room to catch us. Let me just use a layman's, I'm here, catch me, but if you don't screen, you wouldn't know. So you have basically 10, 20 years for you to see a change on the cervix before the cancer itself, I mean, we get to the cancerous stage itself. So mostly when you see the changes, or we have that precancerous lesions, within some few seconds, we have a machine that after checking, we can just burn those abnormal cells there, and then you are free. In fact, you don't even need to be admitted after burning it. All we need is just to book you for a follow-up test, and you are good to go. We have a number of women we've treated, and they are living their life normally without any cancer.
So nowadays, young women engage in sex very early, like teen, you know, yeah. So is it likely that from that age to your 20 years that you've started or you've engaged yourself in, you're likely to have it, or that wouldn't affect, quote and unquote, those teenagers that much? If you compare them to those above 30 years and above, what will be the difference? Are they not going to be, is it not going to worry them, the infection? Is it not going to worry those below 30s, I mean the teenagers and the 30 years and above? Are they different?
Okay, so mostly we have those who are at risk or higher risk of acquiring the virus. I mentioned that almost everyone at a point in time is exposed to the virus, but then our immunity fights it. So those between below the ages of 30, mostly they will get the virus, but then their immunities will fight them because they are very young, their immunities are very strong, and so when they get exposed, the virus clears away. But as part of the risk factors of cervical cancer, those who engage in early sex have a higher chance of acquiring cervical cancer. In fact, the virus, and then if not screened or treated in latter parts of their life, they can get the cancer. But it's not guaranteed that if you have sex within your teens, automatically you're going to get cervical cancer. No.
Okay.
But they become more exposed.
Right. Prof, you also said that the virus can be with you for a very long time. I want you to, or I just want to push you to the wall. How many years can the virus be with you without showing symptoms?
So I think even Esther mentioned at a point. We know that HPV infection can persist for about 10-15 years before development of cervical cancer. So that is what we are saying. That is why we know this is a very preventable cancer, because you have so many years that the virus will be there. It will start making little changes, very little, years go by, little, and the virus is even wondering why you haven't caught it to deal with it, and then it still stays, and years goes on until the changes result in a cancer. So about 15 long years interval from the time a person have persistent infection to the development of the cancers. So really, that is why even when it comes to screening, the WHO target is to say that women from 30 years should begin to screen. If you've acquired the HPV infection below, you wouldn't have, you have had the infection, but your cervix may be fine. But if you have acquired it early, then by 30 years thereabout, we may begin to see changes that we have to deal with. That is why the age for screening starts at 30, and then we can deal with whatever we find at that point.
Okay. All right. Then you keep on saying screening. So how many types of screening do you have for this particular infections? Okay.
So there are quite a number of ways, about 4 ways that we can screen for this. So we have, and the 4 different types are based on, of course, that each has its cost implication, and each has its strength, how good it is in picking the virus and its associated lesions. So we have very basic, simple screening we call visual inspection with acetic acid, where we just, Esther will just paint something little around the cervix, have a look, and just see whether there are any changes. Very simple, very cheap. Not the best test, is the lowest form of screening. And then beyond that, we have tests where we take a swab, some lesions or from your cervix, and go and look at it under the microscope we call pap smear, to look at it for a pathologist to see whether there are any evidence of changes there. We have others, colposcopy, things that look at the cervix and examine it well. And then, of course, we have taking the swab from your vagina upper part towards the cervix and actually going to look for the virus to see. That is the recommended current WHO recommendation, that we should actually take the sample and look for the HPV you have, and then based on that, look at the cervix and decide whether to treat. It is the best, because if you do that and there is nothing, the woman has 5 years before she needs to screen again.
That's very fast.
So when we talk about this screening, one of the message we want listeners to take home is, we are not saying we will come and we say come back next week, come back next month. There is not a monthly testing, it's not 3 monthly testing. Even with the one visual inspection, that is the lowest form of screening, if that is what was done for you, that is what you could do, it's still a year interval before you need to screen again. But if you do HPV testing and everything is fine, you have 5 years before you need to screen again. So all the spectrum of screening are available, because different countries have different things they can afford. The clients have different things they can afford. The point is that there is something everyone can do to prevent this cancer.
All right. I think this screening are meant for people you know, who are on their active sex age and stuff. What do you also have for those who are not yet there? You know, children from 9 years or some years, you know, below that active sexual years. What do you have for them in order to protect them?
Okay, so WHO is pushing so much into the younger age, or those who are sexually naive, because they are future leaders. And so mostly if we catch them around that young age, we are able to protect not only the women or the whole country from cervical cancer, because it's very costly for one to be diagnosed of cervical cancer. The financial implication it will have on not just the society but also the family. And so the focus is to vaccinate girls and boys between the ages of 9 to 14 years, of which we are hoping that next year there's going to be a national vaccination for women, girls between that ages of cervical, HPV. And so there's going to be a vaccination for them between, ages between 9 and then 14.
Yeah, so with time, there wouldn't be screening thing, because as soon as you are born, or when you get a certain age, unless those who are recalcitrant.
Well, so the recommendation still require that even if vaccinated, you screen from time to time still, because what we haven't discussed and is not necessarily focused is that this virus has so many types, and the vaccines we have available now protect. The biggest protection type of vaccine protects against 9 types of the virus, but we are talking about the virus that the types that causes cervical cancer are 14, and then the types that causes genital warts and other ones we have about 20 something. Yes, we have about 40 types of this virus that are problematic. So even though the vaccine is very good, and in fact the vaccination is what has made developed countries basically eliminated cervical cancer, but because it still doesn't cover all the virus type, vaccinated people still screen from age 30, but then their risk is very, very much reduced.
We'll come to talk about how, you know, a person can protect him or herself from this, from getting HPV. But let me also remind you that if you just tune in, you are watching Cafdil television, and the program is Cafdil Healthcare. We come on you every week. We come on your way to discuss with you some important topics or diseases that will always remind you that yes, indeed, you have to go to hospital or visit hospital, either for checkups or for screening or what have you. We're also on Facebook and also on YouTube. And we're still discussing viruses that causes cervical cancer. That is human papillomavirus infection. That is exactly what we're discussing. And so let me come to you, Esther, and tell us exactly what tools are there to prevent this HPV related or HPV virus. Yeah. What can we do to protect ourselves from getting them?
So hopefully next year when we hear of the vaccination campaign, let's try, and then the media, as we are here, give us more, in fact, make more noise about the vaccination, so that people with children between the ages of 9 to 14 will move, or we will go to the available hospitals, to get vaccinated. And then women who are 30 years and above should also visit any facility near them in any part of the country, and then make inquiry about cervical screening, and then the various methods or whatever screening available for them. Okay. They can get screened to know their status. And also, at least you can use condoms. It wouldn't protect you from the virus automatically, but then it also reduces, some part of
The risk.
Exactly. So basically, these are the things.
Prof, do you have some to add?
Yeah. And of course, once we say that something is sexually transmitted, then there is that aspect of behaviors that would increase your risk. So people who have multiple sexual partners or change sexual partners frequently, you are increasing the chance of getting coming into contact with the virus also. So such sexual behaviors would also be something that if life modifications are made in our choices, it would also decrease the risk for such ones. And of course, we cannot overemphasize the fact that, remember, we've said 4 out of 5 people, adults who are sexually active, would get exposed to HPV. So you can immediately see that. Don't sit down and think that, oh, I have had only one sexual partner and so I am not at risk. This virus is one that, as we say, it affects us all. HPV affects us all. So we should think about it in that context.
But can you go to any hospital for the screening? Or we have a dedicated hospital for screening?
No, so I think the point was made that you can go to any health facility and ask about cervical screening because, as I mentioned, there are various options of screening that can be done. And depending on the facility, they may have a particular, so you may go to a place and they say, oh, all we can do here for you is visual inspection. But if you want to do a pap smear, if you want to do the HPV testing, then go here. So for example, in Central Region, if you came to the popularly called in Tibetan Cape Coast Teaching Hospital, then you know that all the types are there. So after the discussions, you can make a decision and what you want can be done for you. If you went to a facility and they have only one type of testing, and after the discussion you want to do something they don't have, of course, they will link you to the next place. So there is no facility designated for screening so that you think I may have to travel only to this place before I can get screening. No, you can walk to any near place and ask and find out what they can do.
The screening, does it cost? Is it expensive?
So I think the earlier point I made was that we have a number of types. The types also relate to the cost. In Ghana, unlike developed countries, this screening, cervical screening, is not covered by our health insurance yet. It's one of the things we will keep pushing for, but for now it is not. So what it means is that you would have to sort of pay for your screening. So that is why we offer you all the various types. So depending on your situation, you can get a test done. So the most important message is that it doesn't matter your financial situation. There is a screening you can afford. And if you can afford the highest form of the screening, it increases the interval with which you have to screen, but still everyone can afford some screening. We don't want to use a specific amount to make anybody think that, but I can assure you there are from very low cost to, of course, a bit of a high cost.
So what is the least interval that if after screening, I should go again? What is the least interval?
The least is a year. If everything is fine, 1 year.
Oh, okay. All right. You are passionate about this as a chapter, IPVS Ghana chapter. And so what are you doing, to help eliminate this HPV virus and its conditions in Ghana?
I think Esther is a recent member, so let her speak about what she has seen us do about that.
Esther, international
Okay,
woman.
so I think on Monday I had the opportunity to join a symposium that took place in National Vaccination Center in Accra, where dignitaries such as the Ghana Health Service Director was invited, the regional minister was also invited. In fact, the other people who are stakeholders and their voices are mostly heard. They were invited by IPVS so that, one, we will be able to push this vaccination agenda of children between 9 and 14, which I mentioned earlier, and then add screening to, if possible, to the National Health Insurance Scheme so that it will give every woman an opportunity to get screened. And so they are speaking to, in fact, IPVS is collaborating with other stakeholders who have a loud mouth, let me put it, to help with sensitization or awareness when it comes to cervical cancer and HPV-related conditions.
So if I may add, we recognize that, for example, we are here speaking English, but not everybody in Ghana can hear or understand English enough to appreciate the message. So IPVS, one of our focus is to produce educational materials in the various languages that can cover the whole country. So as we speak, without much, and in fact very little financial support so far, we've been able to produce educational materials not just in English, in Ewe, in Ga, in Hausa, in Gonja, Dagbani, Fante.
Tree.
And even in tree, not just one, but so we have a Kiapim tree and we have a Santi tree to make sure that the people can understand things in the way they want to. So these are all, and these are the things we hope to be able to do more, so that in addition to the media engagement that gives us opportunity to reach beyond geographical boundaries, we can still get to people through these posters, through short messages and short videos in a language that will speak to their heart, in their mother tongue. So these are all part of the things that we are focused on doing.
So do communities, do individuals, do family have a role to play in this? And what are those roles that you need to play?
Exactly. So, for example, all our educational videos in the message languages I've mentioned include a statement that tells you that there are 3 things that you can do when it comes to HPV and its related condition. First, he said know the facts. Know the facts means that know it, get educated. And he says that share what you know with your friends and family. So once in a family, one person gets to know, we expect that person to also be able to communicate this to their family members, to their auntie, their sister, their mother, their sister-in-laws, and spread the message. So everyone in a family who gets the opportunity in one way through a radio station, a video they received on WhatsApp, to get this information should spread it. That is an important role. But of course, we also support each other. Men should push their wives to go to have their screening. In our cultural setting in Africa, a woman would readily and most likely go to do the screening if the husband says, hey, I've heard of this thing, and I think, have you ever done it in all your hospital? Go and say, no, please go and do it. This woman is more likely to go and do it. So that support also must be there. Of course, when a vaccine is available, families have to take their children to go get vaccinated. So everyone, that is why we say let's tackle it together. In fact, the message in here say HPV affects us all. Let's tackle it together for one less worry. So we are not talking to healthcare workers or government. We are talking to you and every individual that come together with us, and we can tackle this.
Then the Lacoste, we need a Lacoste so that we can, when we wear, people, whoever sees us will know that we'll be able to read. And that is so we those of us in the media, you are doing a great job, of course. Aside wishing you well, I mean, whatever you do, what role can the media also play in eliminating this HPV virus?
Yeah, so of course we are grateful for opportunities like this to have this discussion so that it reach your listeners across places beyond if we just sat at Interbetin OPD and did this talk. Esther has been doing it there, we are doing it there, but it reach a smaller number of people. So we are grateful, and we wish that the media across the country would give us this platform to spread this message. But beyond that, you also have a voice that reach policymakers. So as we are pushing and the government is promising HPV vaccination, the media can help hold them to it and ask about it. We heard there was going to be this. We haven't seen it yet. What is happening? Let's hold people to some of these things. Let's push health insurance to cover at least screening and pre-cancer lesion treatment. You can add your voice to everything that we are saying to these stakeholders, and together with you and everyone, we can tackle this trouble.
So the Ghana chapter, do you, let me go financially, kakra, and see, if the this chapter, Ghana chapter, so will be away screening now, do you have kind of support aside this advocacy? Do you have kind of support financially to those people as well?
Okay, so everything we do is completely voluntary. It is not a paid job. We do not receive any funding. As in fact, the international papillomavirus itself does not receive any funding.
When you hear the word international something,
so it just means that we are not money. One country. That is all the word international means. But we source for stakeholder support so that will enable us to do things. So through partnerships that get us some support, we are able to offer, Esther has screened so many people for free over many periods based on the fact that at that point we had received some funding that allows that. We treat lesions across in various facilities across the country because it's so easy to treat at a very much at a rate that a woman doesn't have to worry about the financial aspect. So the main truth is that we do not have money by ourselves or a source to receive funds to say on that basis we can treat a woman for everything for free or screen people for free. But this is where adding your voice help us to also reach people who can support financially, so that we do not just create the awareness, but when the person gets to know and the person needs some help with the screening and maybe treatment of pre-cancer lesions, we can afford it. Of course, if we can do that and make sure that we stop seeing cases of cervical cancer, which is extremely expensive to treat. What would treat or manage one case of cervical cancer, which is not even curable? That money would have screened and treated thousands of pre-cancer lesions. So we want people to know that, so that we put our effort in making sure we don't even get one case of cervical cancer. That is what the world is wishing for. And now it is basically countries like Ghana, lower and middle income countries, that are contributing to the cases of cervical cancer in the world. The developed world has dealt with this really. So they are just supporting us and adding their voice that we also need together.
This thing just came to mind. Does it have effect on pregnant women?
Do you mean the virus?
The virus.
No. So that is one fact. Pregnant women can be screened for HPV because the virus does not affect the pregnancy itself, but it will just be sitting there in your cervix. So sometimes a pregnancy is considered as an opportunity for screening also, because pregnant women, as the midwives, they keep seeing them and they keep examining them. So as long as there is no risk factor that prevent that woman from being screened, at that point they can still be screened. But the virus does not have any, it is not like, let's say, HIV, that we say the baby can be born with the infection and have immunosuppression. This virus does not tackle the pregnancy.
What about the cancer itself, the cervical cancer itself?
Cervical cancer woman pregnant, that is a big trouble. That you don't want to have on your hand, because the cervical cancer itself alone is not something you want to tackle. And if this is seen in the context of a pregnant woman, it is really a big problem. Of course, there are few cases where it is in pregnancy and it's related issues that they even notice the woman has this thing there and they didn't know. So really, the point is we don't want to scare anybody. We want to say that this is a virus that we can really get off our worry list. Let's do that, and let's not get into this complication of cervical cancer and its related things in pregnancy or not. We don't want to even deal with those.
Anyway, our time is drawing near, and so Esther, let me start off with you. What do you have for our listeners? Whatever you have, tell them.
Okay, so women are very strong. We have a lot of things, in fact, on our list to do. And it's my greatest wish that we should include cervical screening on our list of important things to do. And it will go a long way by helping us eradicate cervical cancer. And also, when we hear of the vaccination, we should try and then get our children vaccinated. Thank you.
So I would just repeat what I have said. This says it all. HPV affects us all. Let's tackle it together for one less worry. Let's do that.
All right. Let me also remind you that in Ghana, this campaign, the campaign ambassador in Ghana now is Diana Hamilton. She has been saying, so certainly we will let you know all this. This is where time will allow us to be with you. Professor Dorcas Obiri-Yeboah is a professor at the Department of Microbiology and Immunology, School of Medical Sciences, University of Cape Coast, and also a medical doctor at Cape Coast Teaching Hospital. And she is also the ambassador for Ghana for International Papillomavirus. Hey, this word. Papillomavirus Society Ghana chapter. And you also, Esther Lamte Mills, also a midwife, registered midwife, not ordinary midwife. It's a registered midwife at Cape Coast Teaching Hospital, and also a member of International Papillomavirus Society, IPV, Ghana chapter. Thank you so much for coming. Thank you for watching, and thanks to all my crew. God willing, same time next week will come your way. Stay blessed.
Mojo.